Welcome to the Mississippi National Guard's COVID-19 Task Force. Today's presentation will cover the Mississippi Department of Health's protocols and procedures for administering the IM COVID-19 vaccines. What to expect. We'll cover purposes of the protocols, policies, and any procedures, your scope of practice as a National Guardsman, policies, vaccine administration and procedures, documentation, contraindications, precautions and considerations, and finally, managing medical emergencies. Section 1, Purpose. Authorization of designated Mississippi National Guard personnel to administer vaccines. A state of emergency declaration has been issued. Authorize designated service members to administer COVID-19 vaccines during the emergency declaration. Who is authorized? Advanced emergency medical technicians, paramedics, 68 whiskeys, 4 Novembers, registered nurses, physician assistants, nurse practitioners, and physicians. Combat Lifesaver Certified Army personnel with approval from the state flight surgeon and the Mississippi State Health Officer are also included. Section 2, Scope. Scope. Vaccination procedures. Only authorized and valid for designated Mississippi National Guard personnel. This includes advanced EMTs and paramedics, but you must be currently certified with the Mississippi Bureau of EMS. The approval by the state EMS medical director is also confirmed. Administration of vaccines will only occur during the COVID-19 pandemic state of emergency and at approved Mississippi Department of Health vaccine sites. Section 3, Policy. Mandatory training. Designated Mississippi National Guard staff and advanced EMTs and paramedics must complete training prior to administering intramuscular COVID-19 vaccines. They may provide vaccinations to persons as directed by the Mississippi Department of Health and the state EMS medical director. Section 4, Vaccination Administration Procedure. Assessment for the need of vaccines will be determined by the Mississippi Department of Health personnel via online and on-site vetting processes. Ensure familiarity with manufacturers' guidelines for each vaccine. Screening questionnaires must be completed prior to vaccine administration. A rapid checklist for prior administration of the vaccine. Ensure there are no contraindications. Collect and review vaccine consent and signed. Verify vaccination administration record or VAR card has been completed. Following vaccination, there will be a 15-minute observation period. Mississippi Department of Health personnel will complete the vaccination administration record. Guardsmen will then sign the VAR as the vaccinator. Return the completed VAR to the patient. Then instruct the patient to proceed to the 15-minute observation parking area. Rapid checklist during vaccinations. Always maintain aseptic technique. To prevent syncope or passing out during administration, patients must be sitting or lying down. Apply a Band-Aid to the injection site. The drive-through procedure includes 1. Seated in the POV with the window down, or number 2, sitting in the POV with the door open, or 3, seated in a chair outside of the POV. Equipment will be provided, particularly during the vaccination. Each dose of the vaccine will be pre-drawn by Mississippi State Department of Health personnel and provided to guardsmen at the drive-through station. Administering the vaccine. Intramuscular deltoid. Cleanse the area in a circular motion with alcohol preps. The deltoid landmarks include 2 to 3 finger breadths below the acromion process. Rapidly insert the needle at the 90-degree angle. Do not withdraw plunger to check for blood flashback. And do not recap needles. Please place in sharps containers provided at the station. Section 5. Documentation. Section 6. Contraindications and precautions. Contraindications to COVID-19 vaccines. Do not administer to persons with allergic reactions or serious systemic anaphylactic reactions to prior doses of the vaccines. Moderate to severe illnesses with or without fever should not consume or accept the vaccine. History of Guillain-Barré syndrome in the past 6 weeks, or any persons with severe allergic reactions to medications, food, or vaccines, pregnant or nursing mothers should be referred to primary care providers. Section 7. Managing medical emergencies. Managing medical emergencies during the 15-minute observation period. Under no circumstances shall guardsmen provide emergency medical care. Syncopal, anaphylactic, or other emergencies shall be the responsibility of the Mississippi Department of Health and local EMS. In some cases, EMS will be on site. In other cases, 911 shall be called in any other instance. In summary, we discuss purpose of protocols, policy and procedures, scope of practice, policy, vaccine administration procedures, documentation, contraindications, precautions, and any other considerations, and managing medical emergencies. This concludes our brief.